Question 21. The answer is A. On per-rectal examination, in males, we can palpate anteriorly the urinary bladder, posterior surface of prostate, seminal vesicles, vas deferens, the terminal part of ureter, bulb of penis, and spongy urethra. In females, anteriorly, we can palpate perineal body, cervix, ovaries, vagina. Posteriorly, the structures are the same in males as well as females. And posteriorly, we can palpate the anorectal ring, sacrum, coccyx, ischiorectal fossa, and ischial spines. 22. The answer is os trigonum. 23. Periosteum is attached to the bone by Sharpey's fibers. It is richly supplied with blood, lymph, and nerve vessels, attaching the bone itself through the Sharpey's fibers. Question 24. The answer is C. The spinal cord develops from the caudal part of the neural tube. The wall of the tube subdivides into the matrix cell or the ependymal, the mantle, and the marginal layer. The mantle zone grows faster in the ventral part and becomes thicker, thereby compressing the lumen of the ventral part. The line separating the compressed ventral part and the dorsal part is called the sulcus limitans. So the sulcus limitans, this is the marginal layer, and this is the mantle layer. The mantle layer gets divided into this is the sulcus limitans. So this gets divided into the lateral wall of the developing spinal cord, forms the alar lamina, whereas the medial part forms the basal lamina. The basal lamina will develop into structures which are motor in function, whereas the alar lamina will give rise to the cranial nerve nuclei which are sensory in function. Since hypoglossal nerve is motor, so it develops from the basal lamina. Lamina will give rise to the third nerve nucleus, that is oculomotor. It will also give rise to the Edinger-Westphal nucleus. It will give rise to the fourth nerve nucleus, which is trochlear. Then motor nucleus of trigeminal. Basically, it has to give rise to those cranial nerve nuclei which have efferent fibers, motor fibers. So, motor nucleus of trigeminal, then nucleus of abducent nerve, motor nucleus of facial, then all the parasympathetic nuclei like Edinger-Westphal, superior salivatory, inferior salivatory, lacrimatory. So all these parasympathetic nuclei. Then it will give rise to the dorsal motor nucleus of vagus. It will give rise to nucleus ambiguus, which is a common nucleus for 9th, 10th and 11th cranial nerves, and it will give rise to the nucleus of the 12th nerve. The lateral part of the alar lamina forms the rhombic lip. The lateral part of the alar lamina will form the rhombic lip, which forms the cerebellum. The cells of the mantle layer, which do not migrate into the cortex, form the nuclei of the cerebellum, which are dentate, emboliform, vestigial, and globose. Coming to question 25, the answer is A. This calcareous is associated with the lateral extension of the calcarine fissure. Another elevation which is seen here is the bulb of the posterior horn, which is formed by the fibers of forceps major. In the roof and the lateral wall, the roof and the lateral wall are formed by tapetum. Coming to the internal capsule, question 26, the answer is C. If you look at the internal capsule, laterally we have the lentiform nucleus. Medially, we have the caudate nucleus and the thalamus. L for lateral, L for lentiform. So lentiform nucleus is present lateral to the internal capsule, whereas caudate nucleus and thalamus are present medial to the internal capsule. Let us look at the parts of the internal capsule. This is the anterior limb. This is the posterior limb. This is the genu. And then we have the sublentiform part, which is below the lentiform nucleus, and a retrolentiform part, which is posterior to the lentiform nucleus. The sublentiform part is associated with auditory radiation, whereas the retrolentiform part is associated with optic radiation. These things are asked in MCQs. Then we have a Charcot's artery of cerebral hemorrhage. The Charcot's artery of cerebral hemorrhage. This is the central branch of middle cerebral artery. And this is very often involved in cerebral hemorrhage. The lentiform nucleus has two parts, globus pallidus and putamen. Question 27. The answer is D. Perforators connect the superficial veins with the deep veins. There are 5 perforators along the long saphenous vein. 1 in the mid-thigh region. 2 below the knee. 3, 4 and 5 near the lower leg and ankle. Coming to question 28, the answer is A. Let us see the auditory pathway. The first order neuron is the spiral ganglion. The peripheral processes of the bipolar cells innervate the organ of Corti. The central processes terminate in dorsal cochlear nucleus and ventral cochlear nucleus. Now these are the second order neurons. From the ventral cochlear nucleus, the fibers will go and they will decussate in the trapezoid body, and then they will go to the superior olivary nuclear complex. Then they will go to the superior olivary nuclear complex. From the dorsal cochlear nucleus, they will form the lateral lemniscus. Then they will go to the inferior colliculus, the medial geniculate body, auditory radiation, sublentiform nucleus, and then they will go to the temporal lobe, area 41, 42. 29, the answer is B. The spinal cord ends at the level of lower border of L1 vertebra. This level changes with the flexion of the spine, and with the flexion of the spine, it becomes T12. If we look at the spinal cord, it has a gray matter or gray commissure in the inside, and outside is the white commissure. Now the central canal lies within the gray commissure. These are the ventral horn cells, the ventral horns and the posterior horns. The lateral horn is present in T12 to L1 segments, where it gives rise to preganglionic sympathetic fibers, and it is also present in S123, sacral 1-2-3 segments, where it gives rise to preganglionic parasympathetic fibers. This is the anterior median fissure, posterior median septum. Question 30, the answer is B. Since the spinal segments involved in the knee jerk and the ankle jerks are at a higher level, so they are preserved and they are not lost. Question 31, the answer is A. Let us look at the development of the pituitary gland. The anterior lobe of the pituitary develops as a diverticulum from the roof of the stomatodium in front of the buccopharyngeal membrane. This will extend up and it will go to the floor of the diencephalon, from where there is a hypophyseal evagination. From the floor of the diencephalon, there is an evagination which will form the posterior lobe of the pituitary. Whereas from the roof of the stomatodium, there is a diverticulum which is formed, which is called the Rathke's pouch. Now this Rathke's pouch is cut off from the stomatodium. The anterior wall of the Rathke's pouch will form pars anterior, whereas the posterior wall will form pars intermedia. The cavity of the Rathke's pouch persists as the cleft. The pars tuberalis is formed by the cephalic part of the anterior lobe. The floor of the diencephalon was forming a hypophyseal evagination, and this evagination will form the posterior lobe of the pituitary gland. The upper part of this will form the infundibulum. Question 32, the answer is B. It is situated at the attachment of the posterior root of lesser wing and the body of sphenoid. The Sternberg's canal is the lateral craniopharyngeal canal connecting the middle cranial fossa with the nasopharynx. It is considered as the congenital origin for the intrasphenoidal meningocele. Question 33, the answer is A, ductus venosus. Ductus venosus is an embryonic channel that allows blood to bypass the fetal liver. You should know the vessels and their remnants. Umbilical artery forms the medial umbilical ligament. The right umbilical vein disappears, the left umbilical vein is left, the left one is left, and the left umbilical vein forms the ligamentum teres, which lies in the lower free margin of falciform ligament. Ductus venosus forms ligamentum venosum, and ductus arteriosus forms ligamentum arteriosum. Question 34, the answer is D. Maxillary nerve is the second division of the trigeminal nerve. It is a sensory nerve. Let us look at the branches of maxillary nerve. In the middle cranial fossa, it gives the meningeal branch. From the middle cranial fossa, it will go to the pterygopalatine fossa. In the pterygopalatine fossa, it gives the ganglionic branches, the zygomatic branch, which will further divide into zygomatico-temporal and zygomatico-facial nerves. Then it gives the posterior superior alveolar nerve. This will supply the molars. Then it comes to the infraorbital canal, where it gives middle superior alveolar and anterior superior alveolar. This supplies the premolars and this supplies the incisors and canines. On the face, it comes out as the infraorbital nerve, which gives palpebral branches, labial branches, and nasal branches. Question 35, the answer is B. Sclera is the thinnermost behind the attachment of recti. The thickness gradually decreases towards the attachment of recti and then again increases. So it is thickest posteriorly. Question 36, the answer is D. The triangle of auscultation is bounded superiorly by trapezius, inferiorly by latissimus dorsi, and laterally by the medial wall of the scapula, medial border of the scapula. The cardiac end of the stomach lies deep to this triangle. Question 37, the answer is D. Here, the main point that you have to note is that the cardiac jelly forms the connective tissue and not the muscles. It forms the subendothelial connective tissue, which is a part of the endocardium. 38, the answer is B. Rasmussen's aneurysm refers to an aneurysm of the small to medium-sized pulmonary arteries, and this is the name given to the Rasmussen's artery is the name given to the bronchial artery. Question 39, answer is B. Pectoral fascia. In carcinoma breast, it is this fascia which this ligament gets invaded by the cancer cells, and this causes dimpling of the skin. As far as the question 40, the answer is D. These lumbricals arise from the tendons of flexor digitorum profundus. They get inserted into the extensor expansion of the digits 2 to 5. The action of lumbricals is flexion at the metacarpophalangeal joints and extension at the interphalangeal joints. The nerve supply is The first and second are supplied by the median nerve. The third and fourth are supplied by the deep branch of ulnar nerve. Occasionally, the third lumbrical may receive its innervation from the median nerve at times.